Speaker. Mr. Deputy Speaker, I am worried. I am worried, and my constituents of Hastings and Rye are worried. There are many different issues that MPs campaign on in their constituencies, but issues to do with health provision must be the most important. We can all agree that maternity services deserve to be a high priority in health planning. This is about safety of mothers and babies. Our hospital in Hastings, the Conquest, has a full-service consultant-led maternity unit. Within the East Sussex Hospitals Trust that we are part of, Eastbourne also has a full-service maternity unit. 4 years ago, it was proposed that one of those units should close. It was proposed that we should have one midwife-led service and only one full maternity service for the area. Mr. Deputy Speaker, the community rose up in arms. We campaigned in our thousands. We marched with babies and with prams. Every local Member of Parliament objected, and we did not let up until we won. And win we did. And I would like to pay tribute at this stage to the able, determined and dedicated campaign leaders, Margaret Williams and Liz Walk. In September 2008, the decision was given by the Independent Reconfiguration Panel, the IRP, which advised the then Secretary of State for Health at the time, that both units should stay open with their full service. The chair of the IRP said, and I quote, "The needs of local women and their families were at the heart of this review. We concluded that women's access to and choices of services would be seriously compromised if the proposals were implemented." This was what the campaigners knew, but we were reassured and indeed jubilant that the final decision makers also took this view. This was nearly 3 years ago. Some people might say, what's the issue now? They might say, why are you campaigning when there is no formal proposal for closure of either units currently on the table? Mr. Deputy Speaker, they wouldn't share my concern, my unease about the latest information coming out of East Sussex Hospitals Trust. We are being signalled that there may be change in the air. It is not change itself we are frightened of, but the possible outcomes for the mothers and babies. The Care Quality Commission visited both hospitals in February this year. They have raised concerns about the maternity services. The Hospital Trust, to its credit, was swift to contact stakeholders and members of Parliament to inform them of this and to reassure us that action was immediately being taken to ensure high standards of safety and to address the concerns that the CQC had risen. And I would like to thank the Chief Executive of the Trust, Darren Grayson, for his swift action to disclose this important information. But I must confess, we are not entirely reassured. We, the campaigners, my constituents, are still worried. I'm not reading any motive or plan into the Trust's response to the CQC. I am merely here to highlight once more that the outcome from these concerns must not lead us down the very same road we have travelled before, namely having to protect our full-service maternity units. We don't want to stick our heads in the sand. If we have problems with the maternity units that might impact on safety in any way, we must address them. But this must not be the short route back down the damaging road to trying to shut one of our units. We simply will not accept that. I urge the Trust not to present that as the answer to the current problems, and I would like the Minister to consider that in her response. Because there are other answers, and they are based within the very problems that the Trust is highlighting, namely staffing. The original view on maintaining both units urged the Trust to address the issue of staffing, i.e. getting the right and safe mix of experience and qualifications in the doctors and consultants. The report of 3 years ago accepted that staffing issues were a problem, but critically, and I quote, urged the PCT to consider alternative staffing models which have not been explored so far. It is incumbent, said the report, on the local National Health Service to explore the potential of these roles to develop midwifery careers and support doctors' roles locally. So they agreed that there was a problem 3 years ago, but urged the local NHS to develop a strategy to deal with it. And yet, here we are. As anticipated perhaps in this very report 3 years ago, we have a staffing problem which is possibly impacting on the service, impacting in such a way that doubt is once more being cast on the viability of having 2 full-service units. Each hospital handles approximately 2,000 births a year. I'm pleased to say that the Strategic Health Authority recently commissioned an external head of midwife to review the leadership, the midwifery and the staffing levels, and she confirmed that the trust was safe. The latest annual regional report also praised the trust for having the lowest C-section rates in the region, therefore supporting women to experience a normal birth. We have 11 consultants covering both sites, and we have our designated number of junior doctors. But we are short of middle-grade doctors. There should be 8 in each site, but we only have 7 in the Conquest, and there are 6 at the DGH, the District General Hospital in Eastbourne. The balance, Mr. Deputy Speaker, is filled by locums. This is an expensive way of staffing the gap. An agency locum costs approximately £79 per hour, which equates to £18,000 per agency doctor per month, as against a trust doctor who costs approximately £9,000 per month. In these times of increased pressure on funds, even where funding is ring-fenced, as in the National Health Service, they are still being asked to make efficiency savings and to improve services, so these locum costs are an unpleasant and substantial addition to the hospital overhead. Unfortunately, the staffing issue is exacerbated by the European Working Time Directive. The arguments against this for parts of the medical profession, I know, are being examined separately, but in the meantime, the outcome from restricting working time to 48 hours simply puts more pressure already exists on staffing levels in these units. I appreciate, Mr. Deputy Speaker, that some might say I am panicking early. We have been reassured by our Trust Chief Executive that there are literally currently no plans to close either units. But there is a consultation about to be launched about how to maintain a top service at both of them. In this reassurance, there is a sting which signals that challenges of staffing may require a change, which I fear could include closure of one of these units. We must not let that happen. In my constituency of Hastings and Rye, we have a town in Hastings that has high levels of deprivation. The teenage pregnancy rate is one of the highest in the country, which in this country is already the highest in Europe, and 22% of my residents are in the bottom 10% in terms of assessments of deprivation. Local doctors who I regularly speak to tell me that young women can be reluctant to attend antenatal classes and often miss their appointments. These are the women who may encounter unforeseen difficulties. These are the women who may need a full-service maternity unit at their hospital. They are not the women likely to hop into their car to Eastbourne for their checkup. In fact, in many parts of Hastings, car ownership is running at only 40%, so they would have to rely on the local bus services and the local roads. We would, if we closed our service, effectively be putting barriers in front of safety for this group of young women. And, Mr. Deputy Speaker, a word about the local roads. I would hope to secure a separate debate on that subject. But let me tell you, when you look on the map and you see it is just over 20 miles to Eastbourne, and the AA tells us that that can be done in approximately 20 to 30 minutes, they are quite wrong. It is more the equivalent of 40 to 50 miles elsewhere. In my experience, it takes at least an hour. The Royal College of Obstetricians and Gynecologists recognises the need for investment to support smaller units, such as we have, where there are significant distances apart. This is what we have in Hastings and in Eastbourne. Because of the nature of the roads, we are a significant distance apart. Those of us who campaigned before know this argument well. But we are up against what feels like the establishment. It is a tide that wants to push us one way, and that is to supersize the maternity units. Beloved of managers, of some doctors, not particularly though, of the mothers. Mothers, expectant women, they want choice, safety, accessibility. I can quite understand management preference for larger units. It's easier to manage a large group of people doing anything, more efficient for those delivering the service, more convenient for the consultants with overall charge, and more flexible for training junior and middle-ranking doctors. But we must not let the one-size-fits-all dominate our maternity services. We must remain aware of local issues that are relevant to any changes in configuration. In Hastings, I put forward geography, deprivation, and the particular needs of some of the youngest, most vulnerable mothers in my constituency. But, Mr. Deputy Speaker, though I speak up for the residents in my constituency, I would urge the Minister's attention on the trend towards addressing staffing issues in hospitals by simply moving towards supersizing units, particularly maternity units. Bigger is not necessarily better. It may sound like an extract from a nursery rhyme, but is actually the name of a highly respected paper about centralisation of hospital services. Bigger is not necessarily better. Mr. Deputy Speaker, even the well-respected King's Fund questions the assumption that outcomes are improved in bigger units. Despite the conflicting view on smaller or larger maternity units, one thing is clear. The staffing issue is about preparing and planning. This was highlighted over 3 years ago in Hastings for the East Sussex Hastings Health Trust. We must demand from our trust now. We do not accept that there should be a consideration of closure for either of our full service sites. We need this complete service. We need, in our communities, the delivery of a safe, efficient local service for the continued delivery of safe and healthy babies.
Deputy Speaker, and I'd like to thank my honourable friend, the member for Hastings, for giving me an opportunity to speak in her adjournment debate. Everything she said I concur with entirely, and with a limited amount of time, because we do want to listen to the Minister, I will focus on a couple of separate areas. First off, I would just also like to add that my honourable friend, the Member of Parliament for Lewis, has specifically expressed concerns also to me this morning, because a lot of his constituents in Polegate and Seaford use the District General Hospital in Eastbourne. A couple of very quick points. I feel I probably walked about 150 miles over the last few years on the Save the DGH campaign. It was an absolutely enormous campaign, cross-party, cross-community support, and led in Eastbourne by the splendid lady Liz Walker, and in Hastings by Margaret Williams, two fantastic community-focused individuals who did a superb job in rallying the whole town and all the political parties. A quick couple of points, Minister, if I may. I'm afraid I'm not a conspiracy theorist, never have been. However, there's an exception to every rule, and just because I don't believe that there's a conspiracy everywhere, I'm afraid there are sometimes. And I regret to say, Minister, that I have some very, very good contacts within DGH. I've spent 8.5 years working in Eastbourne before gratifyingly winning the general election last year, so I have developed some very, very good contacts within the Trust. And I have to tell you, sadly, I believe that the single-siters who originally wanted to move to one consultant-led maternity, though the independent reconfiguration panel turned them down, I'm afraid they haven't got away, and I'm afraid I believe they've used the pretext of the CQC report to begin the process of moving to a single site. We were very active as soon as we heard, and we blitzed the media for 10 days solid, and frankly I think that's what led the Chief Executive of the Trust to say that currently there were no plans to close even temporarily one of the maternity wards. The blunt reality is that there were plans, and frankly I think they were going to. On the middle grade doctors issue, which my honourable friend has already mentioned, there are upwards of 30 different trusts around the country, maternity wards, that deliver outstanding quality of service without 8 middle grade doctors. I think it is a smokescreen. I think it has been seen as such, and I'm not going to tolerate it. I would ask that the Minister speaks with the Trust Board and expressly reminds them, A, of what the IRP report said, and B, tells them to look seriously at the other options other than middle grade doctors. I think that option is to suit some of the consultants as opposed to the patients. I will finish, because I'm terribly keen on hearing what the Minister has to say, with a quote. I wrote to the IRP within 24 hours of this whole thing blowing up again 2 weeks ago, and I got a response the other day, and for the record of Hansard, I'm going to quote from it. It says to me, Miss Lloyd, as you note, in July 2008, the IRP completed a full review of the proposals to close the Eastbourne Obstetric Service and advised that the case to do so had not been made. The IRP also made recommendations about what further action should be taken, all of which were accepted by the then Secretary of State for Health in making his decision. I would urge the Minister to assist my honourable friend and I to keep an eye on the Trust over the next few months and the next few years, because myself, my honourable friend in Lewis, and literally thousands of residents both in Eastbourne and Hastings are not prepared to countenance in any way, shape or form a closure of either one of the consultant-led maternity wards in Eastbourne. Thank you.
Thank you very much, Mr Deputy Speaker, and I would like to start by congratulating my honourable friend for Hastings and Rye on securing this debate, and there is no more important issue for a politician, or indeed a politician's constituents, than the health services available to them in their constituency. And indeed, she spoke with some passion about her concerns of those of her own and those of her constituents, and I note she paid, as did the Honourable Member for Eastbourne, tribute to Margaret Williams and Liz Walk, the previous campaigners from the last time, and they must have a heavy heart listening or reading about this debate tonight. I don't think she is panicking early. She's doing exactly what is right to do, and that is highlighting early her concerns, her fears. And this is in light of some pretty vigorous campaigning that went on some time ago, 3 years ago. I would also like to join her, as I'm sure both honourable members for that area would, in paying tribute to the NHS staff in her constituency for the hard work and dedication that they show, and in common with NHS staff up and down the country, they have the health and well-being of the public as their driving motivation day in, day out. And this will not be an easy time for them, I know, and we mustn't lose sight of that. And in doing so, this government will support and make sure they have the power to provide people with the health outcomes that are consistently among the very best in the world. And it would, of course, be remiss to pretend that the NHS is free from problems, and it's right that people are concerned when they see something go wrong. So I can understand why people in Hastings may have been anxious following the Care Quality Commission's recent inspection. As my honourable friend knows, the Commission's findings raised issues around staffing numbers in particular, which they felt were putting patients at risk and that would affect the quality of services being provided to people in maternity units and in A&E. And from the very beginning, we have made it clear that safety must be at the heart of the NHS, and substandard care will not be tolerated. And as somebody who trained as a nurse and worked in the NHS for 25 years, Mr Deputy Speaker, from my point of view, nothing but the best will do for the people of this country. We expect the Trust to work hard to resolve the issues raised, and I think my honourable friend spoke quite warmly of their response to this. And I understand that they are working closely with the PCT and the SHA to address these issues by the 31st of March, and I would hope, I would expect them to meet that deadline. My honourable friend talked of fears amongst the constituents that the CQC's concerns about the safety of for local maternity units will lead to the Conquest's consultant-led maternity service being closed. And of course, she raised the previous campaign, and my own constituency, Mr Deputy Speaker, is not so very far away. And my own constituents were also a victim of creating an NHS fit for the future. I felt at all times that actually it was fit for the bin, to be honest, I have to say. And I know that in 2008, the IRP advised the Secretary of State of Health at the time that consultant-led services should be retained in both hospitals. And I'm sure both honourable members felt that that would be an end to matters. And I can understand why people in East Sussex are now worried about a possible new threat. East Sussex Hospitals NHS Trust, I gather, has sought to calm those fears by stating publicly that there are no plans for the closure of either maternity unit. And however cynical we might become if we've campaigned a lot of the time on local issues, I think we have to take what we hear as on face value and believe that that is the case. I'm also aware that the Trust has advised local MPs that it will be looking at various options for the future of maternity services, and of course that those services will be linked closely to paediatrics, emergency services and gynaecology, and that the review will have input from external clinical experts, which is absolutely crucial in terms of the confidence that local people will have in this. And I think it is important to stress, as I say, irrespective of local people's cynicism, that no decision has been made in advance. And it has no plans to close any of the units. However, I do understand both her and local people's concerns. Whatever decisions are made, they must be guided by the Trust's principal responsibility to provide that high quality and safe care, and decisions must be made in an open and transparent way with the involvement of GP commissioners, staff, patients, public, and with full consultation and real and meaningful consultation. And therefore, as my honourable friend knows, I can't speculate or prejudge the, what optimum size of the unit might be or the outcome of this exercise. It is right that decisions are made locally without central interference, and the government believes passionately that local decision making is essential to improve outcomes, driving up that quality and sustainability of services for different communities. And my honourable friend ably highlighted some of the issues of deprivation, which I'm very aware of, that exist within her constituency, and also some of the inequalities of health that exist. To this end, the Secretary of State has identified 4 crucial tests that all service changes must pass. They must have the support of GP commissioners. Arrangements for public and patient engagement must be strengthened. There should be greater clarity about the clinical evidence base underpinning any proposals, and any proposals must take into account the need to develop and support patient choice, which again I know my honourable friend raised. And what that means is that service changes that do not have the support of GPs, local clinicians, patients and the local community should not happen. It gives patients and those local professionals, and indeed the local council as well, a far greater role in how services are shaped and developed, and ensures that changes will lead to the best outcomes for local people. And that is completely in line with our proposals in the Health and Social Care Bill, where we said that local NHS services must be centred around the patient, led by local clinicians, and free from political interference from either this House or from the various layers of NHS management. My honourable friend raised in particular the Working Time Directive, and we are committed in the coalition government to limit the application of the Working Time Directive in the UK. It's caused immense problems in the health service, and the Secretary of State will support the Secretary of State for business innovation skills in taking a very robust approach to future negotiations on the revision of the Working Time Directive to achieve that greater flexibility. I would also draw my honourable friend's attention to the King's Fund paper that questions the assumptions that outcomes are improved in bigger units. The King's Fund is right that an effective skill mix is important to get the best out of maternity units, and the Department of Health has commissioned the National Perinatal Epidemiology Unit to undertake a study comparing the outcomes of birth planned at home in different types of midwifery unit and in hospital units with obstetric services. That report is expected in autumn 2011, and it will be very important in providing the evidence for any further action on choice of place of birth. In conclusion, Mr. Deputy Speaker, I fully understand the reasons my honourable friend has for calling this debate. I think she is right to raise it at this very early stage, so local people are clear that they're getting the support from their local MP. That was quite apparent with the passion with which she spoke, and also all of those working in the health service are very aware of her close involvement. I applaud her determination to press for local health services that best meet the needs of her patients, and that whatever measures are taken following the CQC report, following this review, they must be overridingly in the interest of local people.
The question is, this House do now adjourn. As many of that opinion say aye, and contrary no, the ayes have it, the ayes have it. Order, order.